the ALS Association. I'm going to report on Adele Jacobs, who is a fictitious patient who has been known to the Jefferson ALS Clinic in Philadelphia. Adele is a 42-year-old Caucasian female. She was diagnosed with the familial form of ALS in March of 2019. She tested positive for a gene called the C9orf gene. That's the most common gene so far associated with the familial form, which means that it runs in families. Only about 5 to 10% of all cases of ALS are familial. Most of them are what they call sporadic ALS, in which there's no family history. Adele's initial symptoms started in November of 2018 with slurred speech and some choking on thin liquids like water. Her last forced vital capacity, which is breathing out, it should be between 80 to 100, and hers was a 32%, which indicates that she probably has some respiratory impairment related to her ALS. And her NIF, which is breathing in, was -20, which is also low. Adele is already on a machine called Trilogy, and the Trilogy helps the breathing muscles, essentially. It's a assistive device for the breathing muscles. So the Trilogy senses when you're taking a breath in, and it helps you to get a bigger breath in. It's also called an external ventilator. So Adele has been using it intermittently throughout the day. We'd like her to use it at night to sleep, but she's having trouble with that. Adele has refused the nebulizer, the cough assist, and the suction machine. A nebulizer is it's a medication that's put into a machine, and you would breathe in the medication, and it would basically help loosen mucus in the throat. A cough assist can be used after you use a nebulizer, and the cough assist helps to clear the secretions. It helps to stimulate a cough. And the suction can be used also to get out some of the mucus. So Adele's present concerns are her significant other, John, reports that she's had increased choking. She's had some increase in excess of saliva and throat mucus. John also reports that Adele's been spending a lot of time watching QVC and ordering items that they do not need nor can they afford. Adele has had one fall since her previous visit. Adele's functional rating scale, again, the functional rating scale is the scale that they use to look at physical changes associated with ALS. Her speech is a 2, which means that it's intelligible with repeating. Her salivation is a 1, which means that she does have some drooling. Her swallowing is a 2, and that means that you have to be careful with what you eat. Generally, it's more of a softer or pureed diet. Her handwriting is a 3, so she can still write, but it's slow. Cutting foods is a 3, so she can still do that, but she might need a little bit of help. Dressing is a 2, where she could use help at times. Turning in bed is a 3. She's still able to turn in bed, but she's a little slow with that. Walking is a 2, which means she needs some assistance. Usually this refers to needing a cane or a walker. Climbing stairs, she can still climb stairs, but most likely she has to hold on to the railing to go down or up. Dyspnea, which is shortness of breath with exertion, is a 2, which means when she's doing anything, she feels short of breath. Orthopnea is a 1, which means she cannot sleep flat in bed because of feeling breathless. So she has to sleep sitting up. And respiratory insufficiency is a 3, in that she's only using the Trilogy intermittently. Adele uses an iPad to communicate at times. Her SO, John, reports that she tries to communicate verbally and that she gets angry when he tells her that he cannot understand her. Adele is on Medicare and has a supplement of Aetna. She's home during the day. She gets Abrams Home Health Aid, which is a program that the social worker will talk about, for 9 hours a week, Monday, Wednesday, and Friday, to help her with the shower. Adele used to work for Merck in their marketing department. John, her significant other, works from home as a computer programmer. Adele has half custody of a 15-year-old son from Adele's previous marriage. Adele had the cognitive testing done, and her significant other, John, identified that Adele's had changes in excessive spending, which is out of character for her, and possibly decreased empathy, in that she doesn't seem to appreciate all that John's trying to do to help her. They live in a 2-story home, powder room on the first floor. There's a full bath on the second floor with a straight staircase. There are 3 steps to enter the house, the front entrance, and the rear entrance through a garage with no steps.